Please be seated. Good morning and welcome. On behalf of the faculty and staff of the Occupational Therapy Program, I welcome the family and friends of the graduating class of 2022 to Maryville University. I would also like to thank and recognize the guests joining us for this occasion, the faculty of the Occupational Therapy Program, our honored speaker, Mr. Russell Smith, the Dean of the Walker College of Health Professions, Dr. Michelle Jenkins, and Vice President for Academic Affairs, Dr. Jennifer Yukna. I am Dr. Bob Cunningham, the Program Director of Maryville's Occupational Therapy Program and Assistant Dean of the Walker College of Health Professions. I am proud to announce the hooding and commencement ceremony for the Master of Maryville Occupational Therapy to be in session. At this time, I am pleased to call on Dr. Ashlyn Cunningham, who will introduce our guest speaker.
Good morning, and thank you, Dr. Cunningham. My name is Dr. Ashlyn Cunningham, and I have the pleasure of introducing Mr. Russell Smith. Russell Smith graduated from Maryville in 2018 with a Master's of Occupational Therapy. He's worked in pediatrics since his first part-time job in 2009, where he worked as an inclusion counselor and in the before care and after care programs with the YMCA. Since graduating from Maryville's OT program, he has continued to work in pediatrics, including the St. Louis Public School District at Gateway Michael School, Leaps and Bounds, and Rankin Jordan's Pediatric Bridge Hospital. His interest areas include working with challenging feeders and picky eaters, assisting clients with access to augmentative communication devices and adaptive toys, seating and mobility, and in caprices. Russell has also been a frequent guest speaker at Maryville's pre-OT and professional OT programs. I'm also going off script here. I am proud to say that Russell was in my OT theory class, students, and he made it through awesomely. So please welcome Mr. Russell Smith.
Thank you very much, Dr. Cunningham. Good morning, class of 2022. As Dr. Cunningham said, my name is Russell Smith, and I'm a proud graduate of Maryville's Occupational Therapy Program. And I'm excited to talk to you today, not as a professor and not as a superior, but as a colleague. I remember when I first learned what occupational therapy was. I was 22 years old, working as an inclusion counselor at a summer camp, where it was my job to work one-on-one with kids with special or differing needs. I assisted them with not only engaging in the social aspects of summer camp, but also the sports, games, and arts and crafts. Sound familiar? I was hanging out with my camper in the pool during our free swim when another counselor came up to me and said, you know, what you're doing with these kids here at this summer camp is just like what occupational therapists do with kids. And that really piqued my interest. At that time, I had just finished my 4th year at St. Louis Community College, and I had no idea what I was going to do with my life after that. So after speaking to that counselor a little bit more, I looked into the different OT schools in the area and decided on Maryville. And it definitely was not only because that also happened to be where that particular counselor was also attending and who happened to be into the PT program as well. So after graduating and passing my board exams, I was ready to take on the world. I just passed the hardest test of my life and dedicated the last 5 years to learning about what it meant to be an occupational therapist. And I knew it would be challenging, but I believed that through all that I learned on my fieldwork, my classwork, I knew how to be an OT. Sure, I was nervous starting a new job with new responsibilities and roles, but one thing I knew was how to be an OT. Well, I could not have been more wrong. Maryville taught me how to think like an OT, how to analyze the situation like an OT, how to problem solve like an OT, collaborate like an OT, use evidence-based research like an OT. I realized that Maryville gave me the foundation to grow into whatever kind of OT that I wanted to be. And since then, I've enjoyed being an OT more than I ever thought I would. And part of that enjoyment comes from the internal satisfaction and sense of fulfillment that I get from the work that I do. This is the part of the job that's the stereotypical thing to say when people ask us why we became OTs. I just love watching my patients get better. I just love helping people. Everybody says it, and you expect everyone to say it, and it may sound cliche, but if it's not in your blood, then you're not gonna become a great OT, plain and simple. Our line of work allows us a unique opportunity to get sneak peeks into the lives of our clients. We find out their likes, their dislikes, what drives them to get out of bed in the morning. That connection with our clients, their families, and caregivers only adds to the joy and excitement of seeing goals met and our clients achieving new heights. That is what you guys have learned all of these years, how to connect with your clients to provide the most healthy rehabilitation environment possible. So, you all know why you're doing what you do, and you spent the last 5 years working towards it. You all know how to do what you're doing and spent the last 5 years learning how. But when we live in a world where most of you will probably spend greater than 50% of your work week at your job, you will need to think beyond why you're doing what you do. What are you getting in return from what you do? Asking that question of yourself will spur your growth from student to clinician. It's how you build a life around who you are and what you do. For me, it's that feeling of a full heart when I leave work knowing how I've helped my kiddos. Very rarely does a day go by where I don't leave work feeling as if I've had a positive impact on someone's life. And that is what helps me get out of bed every morning, as excited as I can be at the hour that I need to wake up to get to my job. This doesn't happen alone, however. As OTs, we are all part of the healthcare team. And some of you have already experienced this on your fieldworks, working in hospitals alongside PTs, speech-language pathologists, respiratory therapists, nurses, doctors. Those people are on your healthcare team. At my job, my team helps me to feel invigorated and challenged daily, and I could not be more grateful for them. Or you guys might find yourself as a travel OT, where it's just you and the client. That is your therapy team. If you don't know where to start in your growth as an OT, start with the most important teammate, yourselves. Now, it can be pretty easy to feel overwhelmed when you're trying to find your place as an OT within the healthcare world, even if you do have a good idea of where you want to start. Something that I have discovered during my career so far is that OT is kind of the perfect melding of both physical therapy and speech and language therapy. On functional mobility, we got that. Developmental milestones, we got that. Feeding, we got that. Functional communication, we got that. However, we are just one part of a team that can't fully exist without us. That physical therapist will help your client walk to the closet so that they can practice buttoning their shirt just like we taught them how to do in session. That speech and language pathologist will teach our client to speak to a server at a restaurant so they can practice eating with the tools that we help them learn how to use. The knowledge that you have learned from your schoolwork and fieldwork and the lens through which you see ADL and IADL are invaluable to the therapy team. You offer a perspective that not only other disciplines lack, but other therapists lack as well. Each one of you new OTs is different from one another, and you all have a unique voice to bring to the choir of healthcare. Don't be afraid to use it. Another chunk of the enjoyment that I receive from the work I do as an OT is the constant learning and opportunities for self-betterment. This wouldn't be a very good speech, though, if I told you it would be a smooth ride into the sunset full of CEUs, hugs from patients, and high fives from family members. Your failures as a therapist, arguably, make you a more well-rounded and more effective therapist than your successes. When I wrote this, I said, I would need more hands that are here in this room to count all of my misjudgments, mistakes, and missed opportunities. And I may have misspoke, there's a lot of people here. But you better believe that I have learned from each one of those mistakes. Some mistakes and lessons learned have become assimilated and forget them after learning them and move on. But others will stay with us for a lifetime. And I remember my first patient fall. That one will stay with me for a lifetime. I was on my first level 2 fieldwork. I was working with an older gentleman who was easily twice my size, and we were doing some dressing. And I knew he had some right-sided weakness, and he told me that he could get dressed himself. I'd never seen him lose his balance, I'd never seen him fall, until he did. And we can call what happened a controlled descent to the floor. What did we learn? We learned never trust a patient. Always be ready. Keep yourself safe and your patient safe. Remember that for your board exams. Safety first. I also remember my first injury from a patient. I was working with a little one with autism, and he was having a very rough day, and he was trying to elope from our session. So I did what came naturally, put my arms out to stop him from running by me. What did he do? He bit me in the arm, breaking through the skin, and he had never tried to bite before, he had never shown any type of violent tendencies before, but what did we learn from that? You keep your body parts away from a dysregulated child's mouth. You never forget. Every mistake is a learning opportunity, and even though some of them might require a visit to occupational health. The more mistakes that you experience as a clinician, the more opportunities you have to self-reflect on who you want to be as an OT. Did this experience reflect who you want to be? Do you want to change? Is it even necessary to change? Your growth as a clinical professional comes from this combination of self-reflection that you learn out in the field and the critical thinking that you learned here in the classrooms. This is yet another component of who we are as OTs that makes us unique. Speaking of mistakes, let's talk about one of my self-perceived greatest failures as an OT. The day that I was fired as an OT by one of my clients. My client was an older teenager with a TBI, one of the first older clients that I had worked with. And prior to this, most of my caseload was younger kids, and that was the age that I was used to talking to. It turns out that even though I thought I was speaking to this client at an age-appropriate level and with respect, they did not feel that way. And with some help from the speech and language pathologist that they were working with, they came up to me at the end of one of their sessions and expressed how and why they no longer wanted me to be their OT. This was a big blow to my self-esteem as a therapist. I meant no malice by the way I spoke to them, but I learned that the therapeutic process is not just the interventions that I perform in session. A client's rehab is not only what goes on within our sessions, but before, between, and after. Their progress is an immersion experience that I as a clinician play a huge role in, and which means that I can either facilitate growth or regression based on my actions. I was not able to finesse this as a new grad, but since then, I have paid very, very close attention to how I speak to all of my clients. Using that day as a foundation, I have grown. I am not proud that I let that patient down, but I am proud of how Maryville taught me to process my failures so that I can be a better OT. As you reflect back on your hardships, don't let those thoughts take over. Your successes are so important to your career, and they can often help you determine where you're truly gaining your happiness. This can help guide you to be the type of professional that you want to be, even if it's different from where you are now. This includes the small victories as well as the large ones. And these victories were hard for me to see as a new grad. I was constantly questioning if what I was doing was the right thing, constantly thinking that if another therapist was seeing this client, that they'd be making progress faster, that they'd be able to do better interventions. And the harsh reality of those thoughts was, yeah, someone else working with that client might be able to make progress faster, might be able to do better interventions at that time. Remember, you all went to school for this career. You have all the foundational knowledge to work with any type of client. You know the basics of what you learned and wouldn't be sitting here today if you didn't. Frameworks, theories, occupational profiles, strengths and weaknesses. These are all simmering on the back burner for you, and you will find that these become automatic when you are working with your clients. One of the hardest pills for me to swallow was that what is common sense for me as an OT is not always common sense for my clients. That's why they're receiving our services. Don't be afraid to offer what you perceive as a no-brainer. Even other healthcare providers aren't very well versed in what we know as OTs. You can even ask my wife, who's been a PT for longer than I've been an OT, how many times I have to re-explain something about my day or say it differently because she has no idea what I'm talking about. So tell that client to try getting dressed sitting down to conserve energy. Tell that client to make a list before going to the store. Tell the client to remove the extended wheelchair break before completing a wheelchair to mat transfer, because the whole reason they don't use a sliding board in the first place is because the sliding board doesn't rest even on their wheelchair because of the break. That's definitely not a personal experience that I've encountered. Sometimes little changes can make a big difference, and you never know what will make the biggest difference for your client, which in turn is a victory for you. Victories can also be promotions. They can be your kiddo with Down syndrome finally tying that stubborn shoe for the first time. A victory can be a client's mother telling you they could go to a work function while their kiddo could stay home because you taught them how to put their food in the microwave and not burn down the house. A victory can be anything, and I'm excited for you all to experience yours. All right, so we talked about one of my biggest perceived failures, but I'd also like to tell you about one of my greatest successes. My client came to our facility with his mother for an evaluation, and in this evaluation, I learned that the kiddo had autism and that one of the family's goals was to work on self-catheterization. I'll give you guys one guess what Maryville did not teach me how to do. If you thought that teaching a child with autism how to self-catheterize, you would be correct. I was very overwhelmed by this new goal and this new type of ADL that I had to teach this client. So what did I do? I went back to the basics of OT. What motivated this client? Music and swinging. How do individuals with autism typically learn best? Through mass repetition. I performed an activity analysis on the self-cathing process, broke it down into small steps, and was ready to give it a try. And when that client came in and the sessions began, everything began to fall into place. Ultimately, I wasn't able to help this client be 100% independent with self-cathing, but I was able to get them to a spot where their mother was comfortable, and that was a big victory for me. I took my foundational knowledge that I learned here at Maryville and took it a step further at my job. And that which ultimately helped my client and helped me to figure out that this is an element of OT that I am passionate about. And that's what it's all about. Today is your first step into a long journey. Celebrate that you now have the opportunity to open this door. You guys will remember this step forever. So, where do we go from here? We've spoken a lot about how Maryville has prepared us to be OTs. But how do we be OTs? Being an OT isn't just a 9-to-5 grind. You don't stop being an OT once you clock out of work. Sure, you're not working after you leave. There'll be a small part of your brain that you cannot turn off, no matter how hard you try. Soon, you'll begin to notice almost everything you look at will be seen through the lens of an OT. You'll begin to pick out design flaws in products that you see in the stores because they're not ergonomically friendly. You'll be able to help a friend with a complex task by being able to perform an activity analysis in your head and on the spot. You'll be able to teach your significant other a new task by realizing that they learn best by backwards chaining. You'll be aware of how non-sensory friendly certain stores are and begin to understand why you're having and showing compassion for the young parent who's trying to console their crying, dysregulated child in that store. Being an OT is a lifestyle, and you will begin to embody the very principles of occupational therapy. Altruism, the unselfish concern for the well-being of others. Equality, believing that everyone has fundamental human rights and the rights to the same opportunities. Freedom, valuing each person's right to exercise autonomy in their lives and care. Justice, that you will show understanding and care for all in need of what you can offer. Dignity, valuing, promoting, and preserving the inherent worth and uniqueness of each person. Truth, that you, in all situations, should be faithful to facts and reality of situations. And prudence, your ability to govern and discipline yourself through the use of reason. You will make your lives and others' lives more worth living with your focus on promoting meaningful and purposeful engagement in all aspects of life. With this foundational knowledge and all you'll learn on your journeys, your life, your careers, your futures, or whatever you want them to be. Some of you know where you want to start. Some of you know where you want to get to, and some of you might still be deciding. Maryville started me on my journey, and mine isn't over yet. One thing's for sure, though, being introduced to all of you here today on the first day of your journey is something that I will cherish as I continue on mine. And it's with a warm heart that I welcome you all to one of, if not the greatest, profession in healthcare. Thank you.
Russell, that was awesome.
Thanks.
On behalf of the faculty and the graduates, thank you for being part of today's ceremony. We've got a little something for you. Thank you so much. Can we give Russell a hand one more time? At this time, I would like to introduce Dr. Michelle Jenkins, Dean of the Walker College of Health Professions.
Vice President Yukna, it is my privilege to present to you the candidates assembled here who have or will have completed all coursework in the Myrtle E. and Earl E. Walker College of Health Professions at Maryville University for the Master of Occupational Therapy degree. Dr. Betsy Hawkins Chernoff and Dr. Rebecca Birkenmeyer will be hooding our students. As I call your name, please approach the stage. Amanda Hope Beatty. Amanda is from Troy, Missouri, and plans to work in a pediatric setting. Cassidy Jane Collier. Cassidy is from Jackson, Missouri. Cassidy has accepted a position with the Visiting Nurse Association of Southeast Missouri. Emma Marie Ernst. Emma is from Alton, Illinois, and has accepted a position at SSM Rehabilitation Hospital in Bridgeton, Missouri. Emma was the Pi Theta Epsilon Secretary, the OT Student Ambassador, and accepted to present at the 2023 AOTA Annual Conference. Allison Janelle Fluschel. Allison is from Leopold, Missouri, and has accepted a temporary position with Advanced Assisted Living Center and plans to work in travel therapy starting in the spring. Allison was a member of Pi Theta Epsilon, the fundraising chair for Pi Theta Epsilon, a member of Alpha Eta Honor Society, and contributing author to the 2023 AOTA conference presentation. Sarah Elizabeth Funk. Sarah is from St. Louis, Missouri, and plans to pursue a position in neurorehabilitation. Samantha Nicole Geisel. Samantha is from Warrenton, Missouri, and plans to pursue a position in adult rehabilitation. Samantha was the MUSOTA Social Chair and was also accepted to present at the 2023 AOTA Annual Conference. Peyton Philip Giesing. Peyton is from Quincy, Illinois, and plans to work in a school-based practice. Maggie Lynn Groshong. Maggie is from Cape Girardeau, Missouri, and plans to work in school-based practice. Maggie was the contributing author to the 2023 AOTA conference presentation. Julia Christina Gulanzik. Julia is from Sugar Grove, Illinois, and plans to work in the area of pediatrics. Julia was a student ambassador and contributing author to the 2023 AOTA conference presentation. Blasia Marie Harris. Blasia is from Jacksonville, Illinois, and plans to work as a traveling therapist. Amy Marie Heffernan. Amy is from Barnhart, Missouri, and has accepted a position at Leaps and Bounds Pediatric Therapy in St. Peters, Missouri. Abby Elizabeth Herman. Abby is from St. Paul, Missouri, and plans to work in outpatient pediatrics. Abby was a member of the Alpha Eta Honor Society. Kadrin Michelle Jones. Kadrin is from Collinsville, Illinois, and plans to work in pediatrics. Kasia Kaiser. Kasia is from Farmington, Missouri, and plans to work in acute care as a traveling therapist. Kelly Elizabeth Keefe. Kelly is from St. Louis, Missouri, and plans to pursue a position in acute care. Kelly was a member of Pi Theta Epsilon. Nicole Lorraine LaFiore. Nicole is from Chicago, or neurologic rehabilitation. Nicole was a member of the Coalition of Occupational Therapy Advocates for Diversity as the chapter chair. Robin Lynn Lindsay. Robin is from Columbia, Illinois, and plans to pursue a position in the area of pediatrics. Robin was a contributing author to the 2023 AOTA conference presentation. Emma Christine Markway. Emma is from Frankenstein, Missouri, and was the MuSoda fundraising chair. Sydney Ray Madison. Sydney is from St. Peters, Missouri, and plans to work in pediatrics. Carly Rose McCarthy. Carly is from St. Charles, Missouri, and plans to work with adults in either an inpatient or outpatient setting. Carly was a graduate assistant coach for Maryville's cheerleading team. Mia Elizabeth Meyer. Mia is from St. Louis, Missouri, and has accepted a position at Family Forward as a pediatric occupational therapist in the therapeutic preschool. Emily Elizabeth Morrison. Emily is from St. Louis, Missouri, and plans to pursue a position in hand therapy and neurorehabilitation. Emily was vice president of Pi Theta Epsilon and served as a peer tutor. Kristen Elizabeth Percy. Kristen is from O'Fallon, Missouri, and has accepted a position with SSM Day Institute. She was the co-treasury chair in Pi Theta Epsilon. Chelsea Renee Pohl. Chelsea is from Washington, Missouri, and has accepted a position at Delmar Gardens in O'Fallon, Missouri. Chelsea was a treasurer of MUSOTA. Rebecca Grace Raymond. Rebecca is from Arnold, Missouri, and plans to work in a school setting. She was a contributing author to the 2023 AOTA conference presentation. Olivia Josephine Renaud. Olivia is from Wentzville, Missouri, and plans to pursue a position in rehabilitation. Olivia was the Pi Theta Epsilon secretary and also a contributing author to the 2023 AOTA conference presentation. Margaret Casey Roche. Margaret is from Florissant, Missouri, and plans to work in pediatrics. She was a contributing author to the 2023 AOTA conference presentation. Jamie Nicole Sacco. Jamie is from St. Charles, Missouri, and plans to practice in pediatrics or inpatient rehabilitation. She was a member of Pi Theta Epsilon and the Pi Theta Epsilon treasurer. Marissa Rose Schultz. Marissa is from Pacific, Missouri, and was a member of the interdisciplinary feeding and swallowing team. Edward Joseph Sevilla. Edward is from Merced, California, and is interested in pursuing a position in orthopedics or neurology. Edward was the Occupational Therapy Program Student Ambassador. Marion Richter Skillman. Marion is from St. Louis, Missouri, and was the education chair for MUSOTA. Victoria Eve Thompson. Victoria is from House Springs, Missouri, and plans to work with St. Louis University's Occupational Therapy Transition and Integration Services. Victoria was the Maryville Occupational Therapy Graduate Assistant and contributing author to the 2023 AOTA conference presentation. Taylor Sheree Walker. Taylor is from Kansas City, Missouri, and has accepted a position at Family Forward as a developmental trauma outpatient pediatric therapist. For MUSOTA, she was the secretary and OT student ambassador. Michaela Ann Winkler. Michaela is from Kansas City, Missouri, and plans to pursue a career in pediatric occupational therapy. Michaela was the vice president of MUSOTA. Paige Nicole Winter. Paige is from Carmi, Illinois, and plans to pursue a career in hand therapy. Paige was a member of Pi Theta Epsilon Honor Society. Megan Kathleen Whittick. Megan is from Godfrey, Illinois, and plans to work with an adult population in an acute care or outpatient setting. Abby Lane Wright. Abby is from Sparta, Illinois, and has accepted a position at Redbud Care Center in Redbud, Illinois. Lexi Ann Zuber. Lexi is from Olney, Illinois, and has accepted a position at Good Samaritan Hospital. Will all of the candidates of the Myrtle E. and Earl E. Walker College of Health Professions please rise and receive our recognition? Graduates, please remain standing. It is now my pleasure to introduce Vice President of Academic Affairs, Jennifer Yukna, who will confer the degrees.
As Maryville's Chief Academic Officer, it is my honor to confer your degrees. By the authority vested in me by the Board of Trustees and upon the recommendation of the Maryville University faculty, I confer upon you the Master of Occupational Therapy degree as have been completed or will be completed, and invest in all of you the rights, privileges, and responsibilities pertaining thereto. Congratulations. Please be seated.
At this time, I have the honor of presenting the Award for Academic Excellence in Occupational Therapy. This award recognizes a graduating Master of Occupational Therapy student for exceptional intellectual ability and excellence in scholarship throughout their academic career at Maryville University. This year's recipient maintained a 4.0 cumulative grade point average throughout the occupational therapy graduate program and went above and beyond in all her academic endeavors. This student served as co-secretary of Pi Theta Epsilon while working along with Dr. Ashley Wagner to investigate how occupational therapists might use the scientific process to answer occupational therapy-related research questions. Additionally, she actively engaged in all of her academic coursework and was adept at translating evidence into meaningful clinical applications to enhance her own and her classmates' knowledge of evidence-based occupational therapy practice. With great pleasure, the faculty present the Award for Academic Excellence in Occupational Therapy to Olivia Renaud. Olivia, please come forward and accept your award. It is now my honor to present the Occupational Therapy Faculty Award. This award recognizes an occupational therapy student who most exemplifies the characteristics and qualities of the occupational therapy profession. The characteristics of a professional occupational therapist are evident in the graduate who is receiving the award today. Throughout the student's time in Maryville's OT program, they consistently demonstrated a commitment and drive to becoming an ethical, emotionally intelligent, and accomplished occupational therapist. They embodied the core ethical principles of our profession as they pursued excellence in their academics, practical skills, and professionalism. This student embodied the principle of fidelity by demonstrating a goal-oriented approach to ensure continuous personal growth and challenge peers to do the same. The student always strived for the best solution in academic and client solutions, regardless of the amount of effort required. The student demonstrated veracity through their fierce commitment and determination to investigate, relying heavily on evidence to ensure best practice was always achieved. Even when evidence was limited, this student continued to investigate to determine the best path forward. This student has consistently been described as empathetic, adaptable, inclusive, and passionate about helping others feel accepted and successful. With great pleasure, the faculty present the Occupational Therapy Faculty Award to Mia Meyer. Mia, please come forward. Today marks a monumentous occasion in your quest to become occupational therapists. Through dedication, perseverance, and passion, you have achieved the necessary academic credentials needed to begin your careers. You have persevered through a national pandemic and demonstrated significant flexibility and adaptability as you engaged in the learning process. The faculty and I are proud of what you were able to achieve during this difficult time. It's important to recognize that as you begin your occupational therapy careers, that you view it as a journey and not a destination. While you have completed the important first step of formal OT education, your learning has just begun. As occupational therapists, you will continue a journey with the opportunity to change people's lives by helping them participate in the things they want and need to do. The faculty and I encourage you to continue to learn so that you can best meet the needs of the clients that you will be serving. Maryville occupational therapy graduates are recognized locally, regionally, and nationally for their professionalism and depth of clinical skill. You are now part of this tradition and have earned the right to be called occupational therapists. The faculty and I wish you well and look forward to hearing about your future accomplishments and how each of you have contributed to the reputation of the Maryville Occupational Therapy Program. Can we give these guys one more hand? I would like to ask you all now to remain seated until the platform party and the graduates proceed. Thank you.